Hi, I'm Kim Reimold, and I'm presenting on the relationship between governing board composition, outcomes, and Medicare Shared Saving Program accountable care organizations on behalf of all my co-authors. Medicare Shared Saving Programs, accountable care organizations have grown rapidly in recent years. At its conception in 2012, experts repeatedly stated that ACO leadership would be key to the success of ACOs. Early reports suggested that boards were actually pretty similar. 78% of the 2012-2013 cohort had a physician majority governing board. So our questions ended up being, to what extent have physicians continued to play such a dominant role in MSSP ACO leadership? And second, what is the relationship between demographics of governing board members, including gender and professional background, and publicly reported outcomes? For our methods, our study design was a cross-sectional observational study. We used the public use files from CMS and data collected from ACO websites. We excluded ACOs that no longer existed in 2019, ACOs that changed to a new ACO type or merged with another ACO, and ACOs that had missing data. Our independent variables were the percent of physicians on governing boards and percent of women on governing boards. Our outcomes were readmission rates and unplanned admission rates. Our statistical analysis included descriptive analysis as well as linear regression models. Our results showed we included 339 ACOs, 84 ACOs no longer existed, 17 merged, 32 had missing data, and 1 was from Puerto Rico, which we excluded. Generally, the ACOs were found in the South. They were in their first agreement period, which meant they were acting as an ACO for the first time ever that year. And over 50% had a hospital that participated in their ACO. The average board was made up of 12 people, 67% physicians and 24% women. 77% of ACOs had physician majority boards. 11.5% of ACOs had no women on their board, with the majority of boards having between 1 and 25% women. And a large majority of ACOs reported a Medicare beneficiary on their governing board, of which only 31.6% had a woman representative. Higher levels of physician participation in ACO governing boards was associated with lower rates of unplanned admissions for both patients with heart failure and patients with multiple chronic conditions. Of note, greater physician participation was not associated with any difference in readmission rates. We also did not find any association between gender composition of governing boards and outcomes. To rephrase our results in another way, we found that a 1% increase in physicians on the board corresponded to a 0.09% lower risk of unplanned admissions for patients with heart failure and a 0.06% lower rate for patients with multiple chronic conditions. In conclusion, our first big takeaway was that MSSP ACOs governing boards were predominantly composed of physicians in 2019. And this is notable because physician involvement on boards may be very important for achieving quality goals. Our second big takeaway was there weren't very many women on the governing boards. Women made up 35.2% of physicians in 2017, but only made up 18% of governing boards. Management research has found that female board members may impact financial performance in board activities, but we didn't actually see that association in our study. We also saw that only 31% of beneficiary representatives are female, even though a vast majority of Medicare beneficiaries are female. The biggest takeaway from this is that women representatives in both business and clinical positions, as well as female Medicare beneficiaries should be invited to the table when possible. Thank you.